So pulmonary rehab therapy works really, really well for people with COPD and other chronic lung conditions. The problem is that there's not enough pulmonary rehab programs to actually be able to treat a lot of these patients across North America. The statistics are insane. There's like one pulmonary rehab center for every 43,000 respiratory patients that could benefit from this type of therapy. So there's a huge access problem. And we believe that we can actually do something to close that gap through using a virtual type program like we do today. We get to know them, we meet them, we ship them a welcome kit, what we call it. That includes a number of pieces of equipment, including a sensor for their inhaler to track their inhaler usage, the pulse oximeter to measure their blood oxygen level, blood pressure cuff, fairly straightforward, as well as a number of pieces of exercise equipment that will help them do some of the exercises that they'll be prescribed throughout the program. So we treat patients one-on-one with physical therapists that are actually treating and understanding how we can get them moving again to ultimately improve their lung function. We also have respiratory therapists that are educating these patients on a day-to-day about disease management. And then we use our software and hardware to really track the components of the program that are critical to maintaining scalability moving forward. I think the biggest thing is personalization and our ability to actually make this meaningful for the individual through that one-to-one interaction. We're not limited by the abilities for somebody to have to physically go to a center. A lot of these patients enjoy doing this from home and not having to take an oxygen tank across a hospital parking lot into a hospital and doing that 2 or 3 times a week. And that's been a really big driver to the increased momentum that we've seen over these last couple of years. There is just not enough of these programs to treat the amount of patients that could benefit. And we can fill a huge gap by using technology, using that power of relationship, and we're excited to take advantage of that opportunity.